Myiasis. It's a big word for a disturbing condition fly larvae infesting living tissue. These larvae, better known as maggots, feed on the host's dead or living tissue. It may sound like something out of a horror movie, but myiasis is a real and serious health concern. It affects animals and humans worldwide, especially in tropical and subtropical regions. While any part of the body can be affected, some areas, like wounds and ears, are particularly vulnerable. Myiasis is often linked to poor sanitation and hygiene. Flies are attracted to dirt and decaying matter, making areas with poor hygiene prime targets for infestation. The flies lay their eggs in these vulnerable areas, and the larvae, upon hatching, burrow into the host tissue. This can lead to severe discomfort, pain, and even life-threatening complications if left untreated. Auricular myiasis or ear myiasis is a specific type of myiasis where flies target the ear canal. Imagine the feeling of something crawling inside your ear. Now imagine that something is a wriggling maggot. That's the unsettling reality of ear myiasis. This condition is not only incredibly uncomfortable, but also poses significant risks to the ear's delicate structures. Several factors can make someone susceptible to ear myiasis. Living in or traveling to tropical and subtropical regions increases the risk, as these areas have a higher fly population. Poor hygiene, particularly around the ears, also plays a significant role. Individuals with pre-existing medical conditions, such as ear infections or wounds, are more susceptible, as these conditions attract flies seeking a place to lay their eggs. While several fly species can cause myiasis, some are particularly notorious for targeting ears. The most common culprits are the screwworm fly and the common housefly. The screwworm fly, found in tropical regions, is infamous for its larvae's aggressive burrowing behavior. These larvae can cause extensive tissue damage as they feed. The common housefly, while not as aggressive, can still cause significant discomfort and complications. Environmental factors play a crucial role in promoting ear myiasis. Warm and humid climates provide ideal breeding grounds for flies, leading to higher fly populations and increased risk of infestation. Areas with poor sanitation and waste management are particularly vulnerable, as they attract flies seeking food and breeding sites. Additionally, certain medical conditions, such as ear infections, wounds, and skin ulcers, can make individuals more susceptible to ear myiasis. These conditions create moist and nutrient-rich environments that are attractive to flies looking to lay their eggs. Diagnosing ear myiasis involves a combination of patient history, physical examination, and sometimes imaging tests. A doctor will begin by asking the patient about their symptoms, travel history, and any potential exposure to flies. They will then conduct a thorough physical examination of the ear, using an otoscope to visualize the ear canal. The presence of maggots in the ear canal is usually a clear indication of ear myiasis. However, in some cases, the larvae may be hidden deeper in the ear canal, making them difficult to see. If the doctor suspects ear myiasis but cannot visually confirm it, they may order imaging tests, such as a CT scan or MRI. These tests can provide detailed images of the ear canal and surrounding structures, helping to identify any hidden larvae or assess the extent of tissue damage. Section 5. Evicting the intruders. Treatment and removal. Treating ear myiasis involves two main goals: removing the larvae and addressing any underlying infections or complications. Manual extraction is the most common method for removing the larvae. This involves using forceps or other specialized instruments to carefully remove the maggots from the ear canal. The procedure can be uncomfortable, but it is crucial to remove all the larvae to prevent further tissue damage and complications. After removing the larvae, the doctor will thoroughly clean the ear canal to remove any remaining debris or eggs. They may also prescribe antibiotic ear drops or oral antibiotics to treat or prevent bacterial infections. In some cases, if there is significant tissue damage, the patient may require further medical attention, such as surgery to repair the affected area. And Section 6. After the invasion, follow-up care. Following treatment for ear myiasis, close follow-up care is essential to ensure complete healing and prevent recurrence. The doctor will schedule follow-up appointments to monitor the patient's progress and check for any signs of infection or complications. They may also advise the patient on proper ear care practices to prevent future infestations. During follow-up appointments, The doctor will examine the ear canal to ensure that all the larvae have been removed and that the healing process is progressing as expected. They will also check for any signs of infection, such as redness, swelling, discharge, or pain. If any complications arise, the doctor can promptly address them to prevent further damage or discomfort. Section 7. Preventing a repeat performance. Hygiene is key. Preventing ear myiasis starts with good personal hygiene. Regularly cleaning the ears with soap and water is crucial to remove dirt, debris, and sweat that can attract flies. It's important to avoid using cotton swabs or other objects to clean the ears, as this can push debris further into the ear canal and increase the risk of injury and infection. In addition to ear hygiene, maintaining overall cleanliness is essential. Proper waste disposal, particularly of food scraps and decaying matter, is crucial to deter flies from breeding near homes and public areas. Keeping garbage cans tightly sealed and disposing of waste regularly can significantly reduce fly populations and minimize the risk of infestation. Section 8. Keeping flies at bay. Protective measures. Besides hygiene, several protective measures can help keep flies away and reduce the risk of ear myiasis. Wearing insect repellent, especially when outdoors or in areas with high fly populations, can deter flies from landing on the body, including the ears. Choosing repellents containing DEET, picaridin, or oil of lemon eucalyptus can provide effective protection against flies. Wearing protective clothing such as hats with netting can provide a physical barrier against flies, especially in areas where flies are abundant. These hats are particularly useful when engaging in outdoor activities, such as hiking, camping, or fishing, where exposure to flies is higher. Section 9. Quick action, lasting relief, timely treatment. Timely treatment is crucial in managing ear myiasis and preventing complications. If you suspect you or someone you know may have ear myiasis, seeking immediate medical attention is essential. Early diagnosis and treatment can significantly reduce discomfort, prevent tissue damage, and ensure a faster recovery. Delaying treatment can have serious consequences. As the larvae continue to feed on the ear tissue, they can cause extensive damage to the ear canal and surrounding structures. This can lead to hearing loss, ear infections, and even facial paralysis in severe cases. Prompt medical attention can help prevent these complications and ensure the best possible outcome. Section 10. Taming the environment, controlling fly populations. Controlling fly populations is crucial in preventing ear myiasis, especially in areas where flies are prevalent. Implementing effective sanitation and waste management practices is essential to eliminate breeding grounds for flies. Properly disposing of garbage, keeping food covered, and eliminating standing water can significantly reduce fly populations. In addition to sanitation, using fly traps and insecticides can help control fly populations. Fly traps, such as sticky traps or UV light traps, can effectively capture and kill flies, reducing their numbers. Insecticides, when used appropriately, can also help control fly populations, but it's crucial to choose environmentally friendly options and follow the manufacturer's instructions carefully. Section 11. Stay informed, stay safe. Myiasis Awareness. Raising awareness about myiasis, including ear myiasis, is crucial in preventing this disturbing condition. Educating people about the causes, symptoms, and prevention methods can empower individuals to protect themselves and their families from fly infestations. Public health campaigns, educational materials, and community outreach programs can play a vital role in disseminating information about myiasis. By promoting understanding and encouraging preventive measures, we can minimize the incidence of this condition and protect communities from its harmful effects. Remember, knowledge is power when it comes to safeguarding our health and well-being.